How are different types of stroke diagnosed? When it comes to diagnosing strokes, recognizing symptoms quickly is crucial. The type of stroke affects treatment options significantly. There are two main types of strokes, ischemic and hemorrhagic. The diagnostic process combines clinical evaluation and advanced imaging techniques to determine the stroke type, its location, and the extent of brain injury. The first step is an initial clinical assessment. A healthcare provider will take a medical history and ask about the onset time of symptoms. This information is critical. A neurological examination follows, checking for deficits like weakness, speech difficulties, vision changes, and level of consciousness. Stroke severity scales, such as the National Institutes of Health Stroke Scale, help quantify neurological impairment. Next, imaging studies are performed. The first-line imaging is a non-contrast computed tomography scan. This quickly excludes hemorrhagic stroke by detecting bleeding and identifying early ischemic changes. The CORT scan is widely available and essential for acute stroke evaluation. After the initial CORT, a CORT angiography is done to visualize blood vessels and detect large vessel occlusions, which are common in ischemic strokes. Another imaging technique is CORT perfusion, which assesses brain tissue viability. It differentiates between the infarct core, which is irreversibly damaged tissue, and the penumbra, which is salvageable tissue. This information is vital for treatment decisions, especially for candidates for mechanical thrombectomy. Magnetic resonance imaging is also used. Diffusion-weighted imaging is sensitive for early ischemic changes and can detect smaller strokes that a CORT might miss. Additional diagnostic tests include carotid Doppler ultrasound, which evaluates carotid artery stenosis or plaques that could lead to ischemic stroke. Echocardiography helps identify cardiac sources of emboli, such as atrial fibrillation. Prolonged cardiac monitoring can detect intermittent arrhythmias that may not show up on an initial electrocardiogram. Blood tests assess risk factors and exclude other conditions. When diagnosing stroke subtypes, imaging shows whether there is vessel occlusion without hemorrhage for ischemic strokes. Hemorrhagic strokes are diagnosed by CORT or MRI showing intracerebral bleeding. A transient ischemic attack is identified by transient neurological symptoms without imaging evidence of infarction. In cases of embolic stroke of undetermined source, extensive workup is needed. Advanced patient selection for treatment is also crucial. Patients with significant neurological deficits and confirmed large vessel occlusion on imaging may be candidates for mechanical thrombectomy. The time windows for intervention have evolved. Now, imaging helps identify salvageable brain tissue, allowing for treatment up to 24 hours after symptom onset. In summary, diagnosing different types of stroke involves a rapid clinical assessment and multimodal imaging. This helps distinguish between ischemic and hemorrhagic strokes, identifies occluded vessels, and evaluates brain tissue status. Additional cardiac and vascular studies are essential to determine the cause of the stroke and guide prevention strategies. This comprehensive approach ensures timely and appropriate treatment, ultimately improving patient outcomes. Always consult healthcare professionals for personalized advice and treatment options.